Hi everyone, we are live. I can see the broadcast thing over there. I wasn't sure for a minute. Hold on while I pull up our post here. Give me 1 second. There we are. Hi everyone, welcome back. It's been quite a while. I think it's been over a week since I've been with all of you, so I'm very excited to see all of you tonight. We're going to give it a minute. Everybody's jumping in. Hi guys, I see you all there. Hello everyone. So, as you can see, I have a very special guest here with me tonight, and you guys aren't used to seeing me with a guest here in my home, so it is a special night for me. I'm really excited to introduce you all to Dr. Anna Patras, who is more than just my guest. She's also our orthodontist who's been taking care of both of my children for several years, and just a wonderful friend. So very excited to have her joining here with us tonight for a really incredible conversation. Things that I've been learning that even, as much as we know about breastfeeding or I know about breastfeeding, there's so much more that we don't know. And to be able to hear tonight from a true expert when it comes to this part of it, I'm just really excited to introduce you to her and have this awesome conversation. So everybody say hi to Dr. Anna. I want to see you saying hi in the chat room there.
Thank you very much for having me. I feel very honored to be here and be able to speak to all these wonderful young moms who care.
They do. Everybody wants to do the best for their babies, and they're always looking. And I have such a wonderful audience. It's an amazing community of new moms, new dads too, who just want to make the best choices. And sometimes, and we all know it's about good information, education knowledge, which will empower them. So yes, everybody's saying hi. Let's get some hearts going across the screen. Some love for Dr. Anna. They're all going to send you hearts now. There's a little bit of a delay so that she knows there's a delay. So you'll start to see it a few seconds after I ask for it, but they're very good at giving love. So
thank you.
Excellent. All right. So, Dr. Anna, I would really love if you would just introduce yourself, give us your background. It's just so interesting to hear everything that you've done and what you're doing now and why you're here with us tonight.
Well, before I became an orthodontist, I was a labor room delivery nurse.
We have a lot in common. We have a lot in common.
And I used to work night shift and would guide new mothers into labor. For 3 more pushes, the doctor would come. And
yes, I remember those nights.
All night.
So great.
So then I decided to further myself, and I went to dental school. And then after dental school, I went to Columbia University to become a specialist in orthodontics. So it's been quite a few years.
Yes.
And I really love my profession.
And
I love it.
Let me just say, Dr. Anna, one of the reasons we decided to come to you is because you're one of the top people in your field. And we know that. And just an amazing person who just it's a very holistic approach. And that's why we're going to be talking about it tonight. It's a very holistic approach to not just straightening teeth. It's not just about that. And I think that's where we can gain so much tonight of where the beginnings of all this start. And so
I think everybody's being told that orthodontics should start about age 12, and this is way too late.
Yeah.
At age 12, 90% of the head growth is done. So we are pushing teeth into position that we want them to be, but the teeth are not happy. And that was my journey. That the relapse was what really, I started looking at it. Why does this happen? And is there a way to prevent it?
Yes.
And I went deeper into it, and I know that prevention that's what we should do. We shouldn't do the treatment.
Well, that's a sign of somebody who thinks, and to find a physician with a specialty where it really becomes about where do we start so that we can start to prevent issues before they actually, get so bad that we have to correct them. The best way is to create prevention.
I think it starts in the home.
Yes.
With nutrition.
Yes.
Then proper delivery, and then what I would like to talk is the impact of breastfeeding on a facial development.
Yeah.
And
it's something we don't always connect, like we don't, and we always think about, when we think about breastfeeding, and I know all these guys here are, first of all, let's just get a little bit of a feedback here. How many of you guys are new tonight? Because we get a lot of new people, and I just want to see who's new in the chat room tonight, because we always have new people coming. We love to welcome them. So if you're new, go ahead and say, I'm new, so we can all say hi to you and welcome you to the show tonight. And also, if you are breastfeeding right now, you can go ahead and tell us. If you are, you have an older child, I'd love to hear what your background is, because that will help us to understand who we're speaking to a little bit too. So, yeah, there's somebody new, never been to a live. Wait, welcome, Rachel. Welcome, Misty. Welcome, Janelle. They're all new tonight. Fantastic, fantastic. Well, you picked a good one to show up for tonight. You've picked a very good one. When we talk about breastfeeding, we talk about so many different benefits, and it usually has to do with like immunological, bonding, so psychological, nutritional. There's so many different things we think about. We don't always think about structural and facial development
and teeth.
And teeth and teeth. So that's the focus of, and so
straight teeth.
Yeah, exactly. So how is it connected? Because this is stuff that I wasn't even so aware of.
It is the way the baby latches on the breast and the action of the tongue around the breast as opposed to the nipple, artificial nipple.
Mm-hmm.
The tongue stays flat, and a baby's face uses different muscles when they go and latch onto the breast.
Yes.
And that's very important because the action develops the jaws. And if we develop the jaws, then the teeth have room to grow in properly and grow straight. So the palate develops, everything develops properly. When the palate grows from two shelves and then it fuses in the middle, and that's what we can use when we do the palatal expansion. If the palate develops, then the base for the eyes develops, the cheeks, the TMJ, the nasal cavity. Then the baby can breathe properly. Breathing is very important. So we can go on and on of the benefits of breastfeeding, more how structurally we develop.
Yeah.
Very, very important.
So it's not just their jaw, it's not just their teeth, it's everything.
It's the sinuses also, everything. So middle ear, we know that babies or young children get tubes in the ears because they have constant infection. And one of the reasons it's not that the eustachian tube is straight, but also because the ear isn't developed due to lack of breastfeeding.
Amazing.
That's how important it is.
Amazing. So when we hear about, less ear infections in breastfed babies, part of it is the contents of the milk. Part of it is the milk, and part of it is the structure.
The action. It's the action of the tongue and muscles on a breast.
Amazing. So it's just we don't think. So what is it? Is it the baby's palate and mouth? Is it very soft and moldable for a certain time? Is that what it is?
That's what I said. That we are the younger we are, the more moldable we are, and
in every way, right? In every way, right? In every way. Sorry. Yeah, couldn't help myself there.
So the tongue lays flat against the breast as opposed to if it rolls around the superficial nipple.
Yes.
So then the tongue gets displaced and it lays low. And tongue is our natural palatal expander. If during the swallow it stays up against the palate, it pumps the palate and then develops everything else.
Right. And up to what age would you say that this happens?
Really, we should breastfeed till age of 3.
Yeah.
And that's how it used to be, and then go straight to the table food, but not. And I think Gerber is great. But it really should be hard food, and chewing itself also develops the palate and the dentition and everything, the bones
Why don't we talk about that for a minute right here, because it's a good spot for it. The chewing, how
chewing.
is that?
Again, it's the action of force of the teeth that it develops everything palate and swallow when the tongue goes up and rolls a little bit back instead of coming forward because it's displaced from thumb sucking or artificial nipples or pacifiers of different kinds.
Yeah.
So,
if you think about it, and whenever we talk about some of these things, you always consider what our bodies were designed a certain way. And breastfeeding is one of the things that was designed to happen. Right? So there's certain development that occurs just because that is genetically how we develop. And then some of it, just like the way that our muscles develop by movement and walking and being upright. Right? And so
that's exactly what it is.
We were meant to
that's
breastfeed.
Exactly what it is.
Yeah.
We were meant to breastfeed, and we are meant to breastfeed long. And then go straight to the table food and then chew. And table food should be hard. We shouldn't mush. We shouldn't have, like Gerber has this all prepared, and it's the baby just swallows without chewing.
Yeah, so interesting. Somebody saying here, so feeding homemade pureed food is bad?
It's not that it's bad. Prepared way would be not to puree. If the baby can chew it and they already have teeth, it's the preferred way of doing it.
Right. So maybe at least giving them something to chew on, because it's more than just the food. It's about the development of their whole facial structure.
Correct.
Amazing. Yeah, these are things that I think, I'm just reading, I can't help but read the comments here. Yeah, one of them said she has a thumb-loving baby. Yeah, that's hard because it's right there attached to their hand. But okay, so what about the tongue? How does that play a role? So the facial development and tongue position. How does that impact a child?
Tongue, if it swallows properly, or it sits on what we call the spot while a person reads or goes to sleep, it should be always pasted up to the palate, but the correct swallow is what pumps the palate and develops the palate. And again, palate, then the roof of the palate is also the floor of the orbit. And then we can go again to every structure on our face that will develop properly if the tongue swallows properly. And the tongue does not swallow properly because of lack of breastfeeding. It's our society. It's that
because the tongue is actually making different movements at the breast.
Absolutely.
So when the baby's nursing at the breast, their tongue is actually moving in an outward position versus an inward, right? Or not curving.
It's not curving. It's flat, and it uses different muscles.
Interesting. So
during breastfeeding.
Yeah.
So, and that's what helps with muscle with facial development.
Yeah. So when we're talking about tongues, one of the things that frequently comes up because it's so common, and especially when we're talking about breastfed babies, is the idea of tongue ties. And Amanda actually asked a question. Thank you, Amanda. Amanda said, is tongue tie something that always needs to be corrected? And with surgery, and how would a tongue tie affect the latch thereafter, affecting the dental development if it's not corrected by surgery? So let's just start with the beginning of that question with, what about tongue ties?
Tongue ties, I always give an analogy of having your shoes tied with laces. You can tie them closer, you can tie them further away, but you will never be able to walk or run the same way if they are not tied. It's the same, it's the truth for the tongue also. The tongue that is tied to the floor of the mouth cannot come up and cannot swallow properly, cannot pump. Therefore, it's always low. If it is low, it doesn't develop the palate.
And so there's no such thing as a small tongue tie or a big tie.
There are varieties. Because you always, you can run better if the laces are a little bit long.
Yeah, but it's still not ideal.
Still not ideal. And I hope I can again come and present and show the pictures and show picture of what a tongue that it's not tight looks like.
Yes.
Because I even have a tongue tie.
Yes.
And I've been accosted by the myologist, cut it.
And I've been told by Dr. Anna for the first time in my life that I have a tongue tie as well. So a lot of us have this issue with tongue ties, and
absolutely,
and so we are going to do another whole show on that too.
Right, and if you look at my facial structure, you can see that I was a thumbsucker trying to pull my upper jaw forward, and that I do have a tongue tie, and I did not develop high cheekbones, and my eyes are much smaller than they were when I was young.
Yeah.
So there's huge impact on it. Huge. Same with my son. I used to ask, my son had a tongue tie, and I would ask my pediatrician, should we do it? And they said, no, if he can breastfeed, if he can talk and he has no speech issue, don't do it. Until now, I regret that I haven't done it, because I think it did affect his also facial structure.
So it's not just about breastfeeding, and this is what we come up against all the time, is that, and this is, we were talking about it earlier, just the idea that, it's not just is the baby struggling with breastfeeding. First of all, you don't know what it could be if the tie wasn't there, right? So that's one part of it, but it's got longer term effect.
Yes,
it's got longer term,
but it also causes even tongue ties are tied to sleep apnea. So that's another thing. If you have a good facial development, first of all, you would grow, and hardly ever anybody, our wisdom teeth, we don't have the room for it. Yeah. It also, the normal growth is forward and downward, and we don't. We becoming flatter and flatter, and then we are victims of sleep apnea now. Also, retraction orthodontics, where we used to take premolars out. Yeah. Oh, there is no room. Instead of expansion, we would take premolars out. What did we do? We created a society.
Yeah, why did this
society of sleep apnea.
Yeah,
people.
Which has so many effects on your heart, on your overall health, everything.
Strokes, diabetes, type 2 diabetes, it's linked to sleep apnea.
Yeah, so it's got long-term.
Hyperoxygenation, the performance issue, everything. Accidents, you can go on and on.
Amazing.
Car accidents.
Yeah. So
train accidents.
It does have a big impact. Emily is asking, are lip ties as much of a concern as the tongue?
It is, because it will not allow the premaxilla to grow. Premaxilla, it's the front of the mouth. I shouldn't use that term, but just for it just doesn't allow it to grow properly. And even people who look like they have this grown too much and the lower jaw is too far back, it is just that the jaw is too far back. If you bring that jaw forward, you will see that that's the way that the child should look. Not to retract the upper backwards, it's bring the lower jaw forward and allow everything to grow forward. Yes, the lip tie matters. And it's not only because we get diastema, that crack between the teeth.
That's what it's
one of the causes of that crack between is the frenum attachment that goes around. But the growth of premaxilla.
Yeah. Very interesting.
Facial growth.
And yes, and somebody said, it affects latch, but that's just initially. It's impacting the latch, but what is it doing long term is the question. I'm going to throw questions at you because I know you know the answers to these, and I'm watching them here. Mia's saying, what about preventing TMJ?
Absolutely right. Because that impacts also TMJ. Absolutely, because the lower jaw has to come forward. The TMJ comes from the lower jaw being too far back, and it impacts the ears. And a lot of people go to ENT, they say, oh, I have an earache and I feel like I'm underwater. And they look and they say, your ears are fine, go home. And you come back again in 2 weeks. No, I still have that earache. And they say, oh, lady, have some Prozac and go home.
Oh, no.
But this is a real issue of TMJ because the lower jaw is too far back and it presses in there and it allows the disc. And the clicking is because the disc falls off and each time we reduce the disc, we hear click, 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 click.
I have every single one of these things that she is describing right now, and I'm going, yeah, that, and that, and that.
And then pain associated with it, and then degeneration of the joint, and then arthritis in there.
Yeah.
That's all tied to breastfeeding.
Unbelievable. Even these are the things that we don't learn. So it's really great to be able to hear all of this, because we want to encourage to do this as long as possible. You know, to do it as long-term breastfeeding is what's going to help to keep doing that as well. Let me just see here. There was one other question I thought was really good, and now I can't find it here. That's okay. We'll get back. Oh, Kate's saying her 3-year-old has a space between her upper teeth right now, but that doesn't necessarily.
This is great. A baby, the baby should have spaces between the teeth, because we know they grow properly and they will have enough bone for adult teeth to come in. So the baby should have spaces between the teeth.
Yep, and it will close up.
And it will close up as the adult teeth come, because they are larger, and they start closing the gap. So that the gappy smile, it's a good smile.
That's good. Okay, so there you go, Kate. It's a very good, it's a good thing.
It's a very good thing.
It gives space. Yeah. It means that there won't be so much overcrowding. Okay. She's saying it's from the lip tie that is still there.
But this can be remediated by removing the lip tie, but having spaces between primary teeth, it's very important for the adult teeth to grow in properly. Teeth, when they have room, they will always grow straight.
Interesting.
And we can see when we do the, I never call it expansion, I call it development of the arches.
Yes.
The teeth straighten out on their own.
When they have
from the lip pressure and from the tongue pressure, when we train the tongues and we show how to swallow.
Yeah.
And then we do very delicate, not a rapid palatal expansion. I will never do a rapid palatal expansion on a child.
Yeah.
Only slow, and develop the alveolar bone so that the teeth can drop in, and they drop in always straight.
Well, there you got it. There you got it. So first of all, let's get some hearts going across the screen there. That was some great information going on here. We got a lot more to go. As you can see, this is why I jumped right into it tonight with Dr. Anna, because I know there's a lot to talk about, and I didn't want to waste any time tonight. But I want to first of all say hi to our friends Kelly and Patrick from Lack Delight. I see you guys in the chat room. Hi, everybody. And is Amanda there? I didn't see her. Hi, Amanda from Rumina. They're both here tonight, and they are actually our sponsors of our show tonight on this amazing content. So thank you guys, and thanks for being in the chat room. If anybody wants to ask questions, they're there for you as well. Yes, hi, Amanda. So first of all, let me just take a moment. We're kind of like for you in the middle. Joe on cue. You see, he jumps. He hears me, and he knows. We're going to move the chairs aside for a moment, and we're going to bring in the mannequin here, okay, because this is the Rumina nursing tank, and you guys all know this amazing tank, and there's Amanda. And so I just wanted to show to you, for all of you guys who don't know this is one of our prizes tonight. We're going to give away a set of the tank and the nursing bra to one lucky person. But what's so great about this tank is it's a very supportive tank that will open up and allow you to pump, either use as a pumping bra or a nursing bra, where you can pull it aside and breastfeed from this side. So you can either do just nursing, just pumping, or pump one side while you're nursing the other side. So excellent tank. We actually switched it out, Amanda. We got the gray on here so you can see it a little bit better. In the past we had the white, and but it does come in all different colors: black, white, nude, gray, and same with the bras. And there's several different styles of the bras. So you could take that away now, Mr. Joe. Thank you so much. That's the Rumina nursing tank. And then we also have, and let's come back close together here again. We also have from Lack Delight, okay? This is a snazzy little product here, okay? What this is It's a little light, okay? And Patrick actually is a physician. He designed this for his wife Kelly, who they're both here tonight, who's a nursing mom, and she was pumping at night and couldn't see the milk coming out, and so they were, created this little light so that, and I don't know if you could see it when I turn it on. You can see it there, right? So there's two different levels. One is a bright one is a blue one, so it's not so bright in the middle of the night. But this light not only allows you to pump without the lights on, it will also help you to make sure that you're getting good nipple placement in the flange, which is really important to be able to size it properly, to be able to pump your milk effectively, and to avoid pain. So the flange sizing, it will help. It will also help you know when your milk is letting down so that you can adjust the speed and suction dials on your pump, as you all know from my teaching you all this time. And so this is a really, really great product. It comes in a little pack of 2 in this cute little box, like jewelry. See, like jewelry. It's a perfect little Mother's Day. A little Mother's Day present. There you go, Mother's Day, okay? And if anybody wants to get the latch, first of all, we're giving a set of these away tonight as our prize as well. And then they're also available on their website, which Joe is going to pin up. And we have a discount code for you too that we will post for 15% off. So there you go. Yay. Thank you, guys. Thank you for those. Oh, there. Lactolate just put up. The code is Shari. Very simple. Very simple. Okay. Yeah. So they just put that up. But we love them, and we're very grateful to them for making all of this possible. All of this possible. Okay. So the question that came up. So, and this is, I knew this is part of it. All right. We're talking all about breastfeeding and the importance of how that impacts facial development, the jaw, every part of the face and the head. What happens when we have moms, which we do, which we're talking about right now, pumping, bottle feeding, unable to breastfeed at the breast, but are also using bottles, whether it's in combination feeding, where sometimes they're going to work for certain feedings and then they're breastfeeding, and other times where they're just exclusively pumping for one reason or another. What can we do to support them? Because obviously this is a question.
So the very important thing is to make sure when the baby goes to sleep to close the lips and teach the baby to always have closed lips. The baby will mimic mom. So if you show them how to close, they will close their mouth.
Interesting.
And then
come closer to me.
I'm sorry.
That's okay. That's okay.
Any early intervention.
Yeah.
We start in our office as early as 4 years old. If the child is mature enough to come over, that's how soon we start.
For evaluation
and for intervention if an intervention has to be done.
Interesting.
And as I said, maybe next time we'll show the different telltales for mom to see and look at the child. And all of our children, we all think that they are the cutest ones, and they are, but they not necessarily will develop to the optimal way. We have very good genes, but because epigenetics or how we raise our children or inability to breastfeed. There are people who do breastfeed, but still introducing soft food allergies. That also impacts mouth breathing, impacts very much so facial development. So that's why we start early. We make sure that they have their mouth closed, keep their tongues up, and we do work with not expanders, but to develop the bone.
Very interesting. And we'll cover that in another episode. Because Dr. Anna lives like 1 mile away from my house, which is very convenient, versus Dr. Susan, who's in the south of France, who gets up in the middle of the night to do this with me. We will have Dr. Anna back to talk about some of these things that we're discussing right now. But what about, I wanted to show the nipple on the bottle too, because this is the first time she was seeing this particular nipple.
And I like it.
You like it?
Yes,
tell me what you like about this, because I think it's the part that we need to think about.
because as the baby latches on it, I think, it's able to open the mouth and put the tongue. It doesn't fold. It doesn't. I think that's how the breast looks like when the baby latches on.
Right.
It's not flat.
Right.
It just comes forward.
So what we're describing here is the baby, when baby latches to a nipple like this, their lips are going to rest at the base, which means the nipple, the tip of the nipple, will work similar to what we would see with the breast, which is the nipple. When you're breastfeeding, they're not sucking on the nipple. The nipple is going so far back in their mouth. It's between the hard and soft palate. It's far back. They're latching onto the areola, which this is kind of.
Right, then the tongue pumps it out.
Right. So this would be more of a rounded piece.
Correct.
Yeah. So, okay.
I
So
mean,
there
this
you go.
is the first time I see this nipple, but I'm impressed.
Yeah. Well, I can tell you right now, even Flow Feeding will be very happy to hear you saying that. Yes, they will. Okay. So this is the balance bottle. And I've had some really, it's amazing because not only have I found that it's what you're saying, which is a better position for baby, better shape, but for babies that are exclusively breastfed who are refusing bottles, which a lot of times they do, they're taking this bottle. So there's a reason, obviously. It's more because like sucking on the breast.
Familiar.
More
just
familiar.
Like
Has anybody used that before and have any good feedback? If you have, go ahead and say that right into the chat room right there. I'd love to hear from you guys. So, okay. Let's see. Oh, they're talking about nursing clothes. They're talking about all kinds of things. All right. So let's move on here. The pacifiers. What about pacifiers?
I would advise to stay away from them.
Stay away from them.
But
Okay.
if needed to be used, because you have to go to sleep and a baby has to go to sleep. I really don't know different pacifiers.
Yeah.
But I would imagine that they would make something similar to that. That it's flat, it's not skinny, so that the tongue.
So when they talk about orthodontic nipple pacifiers, like where they're flatter,
I think that would be a better choice.
A better choice because you're not rolling the tongue so much. Okay.
And I think the action.
I never understood what the orthodontic, what they meant by an orthodontic pacifier, but that's what they're talking about.
And probably the action of the pacifier, because the swallow, the reverse swallow is when a child sticks the tongue forward and then uses the muscles, including the cervicals, for swallow. The swallow should be silent. And I can imagine that there has to be a nipple that it's geared toward the facial development more.
Not necessarily. I have to say, we have to look at that because we might have to design one.
Very good idea.
We might have to design one because I'm not sure. A lot of what I see out there is very marketing, and it's not really that well thought out by the right people who know what needs to be done to create proper development. So maybe we need to design one there. I think we got an idea.
What a great idea.
What a great idea. I want to go back to something you said about mouth breathing. Can you talk a little bit more about that? Because you had explained it to me at one point, and
first of all, what's the cause of mouth breathing? We can go later and see why people have to mouth breathe. But if a person mouth breathes, first of all, they never get oxygenated. It's hyperventilation on a big scale.
Okay.
So when a person mouth breathes, first of all, let's talk about oxygenation.
Yes.
They never get enough oxygen into the cells. They have it attached to hemoglobin, but it doesn't get unloaded because CO2 is needed to bump that oxygen off the hemoglobin so it goes into cells. So therefore we have children with ADD, ADHD, that's really linked into mouth breathing. It causes, just like snoring, a slew of different ailments. So the whole body is affected, but how facial development is affected is because to mouth breathe, you have to open the mouth, first of all, then you have to lower the tongue. With the mouth open, the lower jaw rotates back and we grow vertically and we are kind of on a skinny side.
Yes.
And because the molars super erupt,
yes,
we also have open bites, and we can go to different ways what happens in a mouth, but the palate collapses. Palate, it's a bone. If not supported, it's going to collapse.
So it creates more of
it's
a,
right.
like
it's
a V shape.
Yeah, the arch form is V-shaped this way, but the palate, it's like Gothic palate. It should be, palate should be low and round, not this way.
Yes.
And the arch form should be U-shaped.
Yes.
Means how our teeth are. The whole thing should be U-shaped, not V-shaped.
Gotcha.
So we see a V-shaped arch, we know that the tongue does not sit up there. And again, it doesn't develop the whole face, including TMJ, nasal passages, then the nose is skinny, then for the entire life, it impacts us all, and then sleep apnea again.
Yeah, very interesting, very interesting. Yeah, you know, it reminds you how important it is to start from the very beginning, to be looking at everything we talk about. And we're going to be talking about some other topics as well, from the microbiome to epigenetics to like, there's so much to discuss. And the more that Dr. Anna sit here and I sit together, we realize how many more topics we want to talk about. And we're really on the same page about a lot of different things. I want to just get a little bit of a impact. Let's see what's going on here in the chat room. They're loving all the information. They're a first-time mom. This is great information, isn't it, Stephanie? I'm really glad that you're here. I'm glad that you're all hearing this. It's a little bit different than what we've talked about in the past. Actually, it's a lot different. But where do you ever get to hear any of this stuff? I mean, I never get to hear of it. I know they don't get to hear it. So
I wish I knew that when I had my baby.
Yeah, definitely.
I would really. Yeah, the tongue tie and mouth breathing.
Yeah. Well, even the pacifier use, you know, like we know that there's pacifiers that there's benefits to it in some ways, which babies need to suck, and sometimes you can't be the only one for them to suck on. And also we know that there's some benefit to the reduction in or prevention of SIDS when it comes to pacifier use when they're sleeping. And those are some of the benefits. But then we're listening to this and we're saying, you know, just having a pacifier in that child's mouth 24/7, and you know, you've seen that. You might be one of the moms who are doing that. You might see people who are constantly relying on the pacifier. I would think that less use or minimal use. So when they're sleeping and then taking it out. Once they're not,
correct.
Once
and
they fall asleep,
closing the mouth
and close it.
Yes.
Will their mouth stay closed when you do that?
They
will.
Right.
Yeah, and they'll start to. And infants really are obligatory nose breathers anyway, right? So if you can train them to stay that way, I'm asking these questions and saying
absolutely they will stay that way.
Okay. Fantastic.
I mean, mouth breathing is related also to nutrition and what we eat.
Yeah.
So even though we do not have frank allergies, that we see the hives, doesn't mean that we are okay with the food we eat.
Yeah.
And what's good for one person doesn't mean that it's good for another one.
Yeah, yeah. Alyssa said, I love you, Dr. Anna.
Oh, thank you.
And I could listen to your knowledge all day. That's what she just said. Let's get some hearts for Dr. Anna because they're giving you a lot of love here. And it's hard for us to read so far away with our eyes back here. So when we see the hearts, we can see that the love's coming across the screen. You guys enjoying this? Yeah, I knew you would. I was sitting in Dr. Anna's office. She was explaining all of this to me, and I thought, okay, we're doing a show, and she hasn't done Facebook Live yet. This is her initiation into Facebook Live, but I thought, my audience is so amazing. They're going to want to hear this information. You see how happy they are? They're very happy to have you here. They're all giving you a lot of love. We had another question that came in from Laura. And Laura asked a question about her dentist told her that she should be brushing her son's teeth. He has 4 teeth. And with toothpaste, but he can't spit yet. Is it safe to use toothpaste?
Well, the first thing I would want to say, toothpaste without fluoride and organic toothpaste. So we have one example.
Yeah,
there are many other toothpaste. This just came across. Mm-hmm. One of my patients actually brought this in, and she said that's the only toothpaste my child would brush teeth with. and we check the ingredients, and I think it's a great toothpaste.
Yeah. Okay, great. So definitely something without fluoride. And I know we will talk about this on another show, but just minimally, because we have some time. Do you want to talk a little bit about what to not make them not so they don't swallow it, so that they don't, I mean, fluoride's not something that you want to be using much, right?
I would not.
Okay. Let's say that. Okay, because you're going to get a lot of different answers about fluoride, and Dr. Ann and I are going to do an entire show about fluoride and other things about that. But it's one of those things that I think is important to avoid. Do we really need it?
We should avoid it as a dentist. I think we should avoid fluoride. It affects the bones. The bones become more brittle. Bones should be resilient. I don't know whether it really prevents cavities. I think good oral hygiene, limit the sugar intake.
Yes.
Very important. And we don't even think what sugar is. Even bread is sugar.
Yes.
So sipping soda all day long, sipping juices all day long, every 20 minutes, we need 20 minutes for the saliva to get back to the optimal pH. So each time we take a sip of either soda or anything sugary, it changes saliva into acidic, and that's how cavities happen.
Yeah.
And fluoride, I think it affects the thyroid, it affects everything.
Yes.
So I would stay away.
Yeah, I agree. We don't use fluoride.
Do it more organically. There's so many different toothpaste now on the market.
And right in the supermarket. You can get the Tom's and
right.
A lot of people realize like fluoride's not a great thing, and especially when ingested, and a lot of people are going to get recommendations from their pediatricians, and I'm going to straight out say it right now, you get the recommendation to take fluoride supplements or give your baby fluoride supplements.
I would never do it again. I did, but I would never do it again because I didn't understand.
Yep.
Back then.
Absolutely.
But my grandchildren are not getting it.
You know what? We do better when we know better. And that's the whole point. Like even our conversation tonight is to keep on bringing awareness to certain topics, because these are, sometimes you don't even know what to ask. New moms don't know what to ask, unless they're being given the information. And, some people are sitting here tonight listening to this and going, I had no idea there was even a question about fluoride. That's something that, we're not going into every detail about it, but it's a great start for them to do their own research, to look into it, to question your doctor, to question the information and make your own choices about,
and learn from other people.
Absolutely.
I mean, there is so much information about fluoride now on the internet.
A lot more than there used to be. When I had my kids, so my children are 15 and almost 13. And that's a whole, they're beautiful when they come to see you in the office, and then they come home. They're still beautiful, but they're teenagers. I definitely have a teenager. But there's one of the things we talked about recently when we were saying, there's so much information. The internet's a great thing. It can have its negative. It can have its negative where you can have a lot of different information from people that you don't know. What is their background? What is their knowledge? Am I listening to the right people? But then you can have times like tonight where you're sitting with like an expert that's actually giving you information, or when I'm talking to you about breastfeeding or childbirth, and you're really getting good knowledge, so that, I feel like you can't really make a real choice unless you're educated.
Correct.
Otherwise, it's not really a choice. It's not really a choice. And of course, you'll always have that choice for yourself. So what else was there that you have your model here. They love props. We love props here. So go ahead. Let's do the props.
I forgot about my model. I brought the teeth.
Yes.
And with a very moldable palate and gingiva. And I would like to demonstrate. This is still not what I would say it's optimal, but you can see that what narrow palate does.
Bring it closer to the camera so they can see it. There you go.
So same amount of teeth.
Yeah.
That's a V-shaped arch. That's more of a U-shaped arch.
That's a great visual, so you can really see it.
So you can see that we have the same amount of teeth, but now we have a very narrow palate, and now we have really crooked teeth.
Mm-hmm. Are you gonna fall out?
Right. Oh, we can extract one in here just in case.
Make it really real.
Yeah,
Okay.
really. So when we take premolars out in here, and then what happens? So we take the premolars out. They say, oh, your upper is sticking too far. And then we squeeze everything this way. What happens? There is not enough room in here for the tongue to function.
Yeah.
So now we have the same size of the tongue sitting in a very narrow palate.
Right.
What happens when you go to sleep? You relax, tongue goes back down the throat, and that's what causes sleep apnea.
Snoring, sleep apnea.
Correct.
You have obstructed airways. How many people in the chat room had braces and on your own teeth and extractions and work done on your own teeth? How many people have had that? Because we're seeing it more and more. I mean, it's way different than it used to, including what you were describing about tongue ties. We're seeing more. There's a lot of different things that we're seeing now that we never saw in the past.
Because it's epigenetics. That's what it is. The environmental influence on our bodies. What we ingest, what we put in our bodies, that's what we are going to get out of it.
Right.
So we can go on and on with that. I don't want to. I feel like
they want to hear stuff, so it's okay. We have time. We have some more time.
But talking about environment, when we put wrong stuff in our bodies, that's why we have cancer, because we are always bombarded with something that it's not organic, it's artificial, and our bodies do not tolerate it well. So we have methylation issues. That's why a lot of methylation issue people have the midline, like tongue ties and lip ties, because we are more susceptible than if we have methylation issue to different medications. We cannot do certain stuff because of it. So we can go on and on.
Yeah.
What happens to our bodies, and everybody knows.
Our bodies are affected. Yeah. They're affected. They grow differently.
They grow differently, and that's epigenetics. Because we do have good genes. Our genes did not mutate to a point that, why shouldn't we grow wisdom teeth? I have few people in my office who grow wisdom teeth. These faces look completely different than the ones that do not. And now imagine.
You mean where they're not impacted, where there's room for them?
Room for them, and they come in.
Interesting.
And we should have all 32 teeth. Now we don't. We have 28. Plus we take premolars out.
Yeah.
So now we decrease more and more and more volume.
So you're basically trying to accommodate the facial structure with the teeth versus the teeth.
But the teeth get retracted. They go toward the tongue space, and that's why sleep apnea.
Oh my goodness! Wow, it's just like a whole cascading effect of things that happen.
Correct.
Yeah.
Correct. So.
One of the topics we talked about a little bit, I don't know if you have time to actually discuss it, but was the whole idea of milk and calcium and I'm going to tease her here on bringing up these topics. It's okay. We can touch a little bit on the idea of calcium on our teeth, on our bones, because we think about, and I had someone recently who was told to go home and drink a couple of quarts of milk. I don't know. The pediatrician was saying, that's how you're going to make more milk, was go home and drink that. It's just absurd.
I really do not know how milk affects the breast milk production.
It's not in a good way. Not in a good way.
It makes the body very acidic. The way the milk is prepared, it's not raw, it's not organic. It's even if it's both organic, has to get pasteurized, and that very much makes our body acidic.
Yes.
So that's why we have a lot of calculus on our teeth. And I see very young children with so much calculus that in 6 weeks,
which is the tartar. I needed to know what that was too, the tartar.
So 6 weeks later, we can't even close the spaces, or we can't move the teeth because it's so caked up. And each time when we ask, what's your diet? Do you drink milk? That's what they do. If the milk was so good or rich in calcium and helping our bones, why is it also fortified with calcium?
Right.
And it's fortified with artificial calcium. That's not a good calcium. That's not the calcium we need. Having our bodies acidic makes the bone brittle again. That's why we have osteoporosis, osteopenia, osteoporosis, and that shouldn't be. People used to live long and they didn't break bones the way
because we hear
now.
this all the time, that you need drink milk to have strong teeth and bones.
No.
And it's really not true.
It's not true.
It's not true.
Because the more, and they have more cavities, children who drink milk, because milk also is sugar.
Right.
In a way.
Right.
So when it sits in a mouth all night long after the baby feeds and you don't get a chance to clean and wash, babies have cavities, rampant cavities because of it.
Yeah.
So,
which is different than breastfeeding during the night. I have to say that.
Breastfeeding is no, I'm not talking breastfeeding.
Right.
I'm talking about bottles
of milk.
Correct.
Yep. Definitely.
Correct.
Definitely.
And milk in general to me is also mucus producing. So the nose is always clogged. Mouth breathing starts. A lot of people have sensitivity to milk, and I'm not talking about people being lactose intolerant. No. It is just in general, milk isn't good at all.
You're not the first one to say this with me. Dr. Susan, who's the pediatrician who comes on with me too, she has a whole chapter in her book about milk is not for human consumption.
No, it is not.
And we did a whole show on that, which we're going to be doing another one coming up too. Maybe we'll do it together, me, you, and Dr. Susan in France.
And I knew a doctor who called milk cow's pus.
Cow's pus. Very nice. Okay, there you go. That's to your health. Yes. We are not big milk fans. So milk is bad. Milk is not. It's not good. Laura, it's not good. It's not the ideal thing that I would drink. We don't have any milk in our house. I have to tell you, we don't keep
any milk. Any milk products, even milk chocolate.
Nothing.
I would go for dark chocolate, but
she's better than me. She's better than me. I can't say don't do that, but we don't drink milk. It's really not. It's not necessary. More than not necessary. It's not healthy for you. It's not healthy.
It is not healthy.
It's not healthy. So you just like cow's milk.
And even ratio. I'm sorry.
Somebody's saying, what's a nutritional option for milk then? Like what?
Almond milk.
Almond milk. Coconut
macadamia, coconut milk. If somebody likes, I don't like coconut, but I don't need milk. But if people love milk, go ahead.
You can use it as a substitute. So if you're looking for cereal to put into your coffee, I use coconut milk to put into my coffee. But other than that, I don't use milk for anything else. I don't drink glasses of milk. We're just not in the habit. And my children don't either, by the way, because we gave it up so long ago that they've forgotten,
And they don't like it.
Yeah, they actually, one of them drank it recently and then she got sick. And she said, I'm not going to drink milk anymore because she's just, not used to having it and it wasn't very good. And you're going to, especially at the very least, let me say this, if you're going to keep drinking milk, make sure that milk is 100% organic and hormone-free and steroid-free and antibiotic-free, and you do not want to drink regular milk. You don't want to drink milk at all, but if you're going to drink it, make sure that it is organic milk.
The best is to stay away.
Stay away. Yeah, definitely stay away. Cashew milk. She's saying cashew milk is
fried macadamia milk.
There's lots of different milks.
There are no.
The point is that you don't need the calcium from this because we can get calcium.
You do not get calcium.
You don't get calcium.
Milk.
Right.
The ratio between phosphorus and calcium in milk is such that it does not allow us to get any calcium into our bones.
Right. So it's not a
Plus, it makes it acidic, so it even makes the bones more brittle.
So interesting, because it's the opposite of what we're being told.
Correct.
And there's a lot better ways to get calcium. And
there is.
Yeah. So, let's see here. What do we got? Oh my goodness, they're loving this conversation here about all of it. Coconut milk, cashew milk, almond milk, all these different nut milks. Yes, there's a lot of really great options. And Yeah, I'm really glad we got to all these different things. So, did you guys learn something tonight? I love that we did this topic, and I love to have you, Dr. Anna, here with us.
Thank you
Wasn't
for
this so
having me.
much
I really
fun?
appreciate
Wasn't this
it.
see
Absolutely.
how fun it was to see everybody there? Let's give some hearts for the conversation for Dr. Anna coming out at 9 o'clock at night here, 10 o'clock now, to do the show with us. We're going to come back and do more at another time. We'll come up with different topics that we couldn't get into in total detail. But we would love to have you all back again, and we'd love to have you back again to discuss more.
Thank you for having me.
To win the prize tonight. Okay. Oh, by the way, I just want to mention we've got some really great stuff coming up. I'm going to just give you a couple of my upcoming events. This Saturday, we have a very special live stream, okay? It is with Lindsay Gerst, who was with us for our postpartum depression conversation. She's the executive producer of When the Bow Breaks. She was on a few weeks ago talking about the film. And this weekend, I have her and Mark Williams, who is the founder of an organization in the UK right now that is spearheading postpartum depression in men and fathers, and the incredible prevalence that we're seeing, and how it shows up differently, and all these different things. And so we're going to be having this great conversations. There's going to be 3 couples. Joe and I are actually going to do the show together for the first time, where he's going to sit with me. Lindsay's going to be on with her husband Brad, who they went through a postpartum depression, and so is Mark with his wife Michelle in the UK. We've got an international audience that's going to be joining us from all over the world on Saturday. And so we decided to do two times on Saturday. We'll be doing it live at 5 p.m. No, is it 4 p.m. Eastern time, 4 p.m. Eastern, with everybody. And then we'll be replaying it live with Lindsay and I in the chat room at 9 p.m. on Saturday night. Okay, so if you can't make the middle of the day, we tried to accommodate everybody over in the UK and all over the world, and then you can join us again at 9 o'clock Eastern time, where we will replay it, and we'll be with you in the chat room answering questions and just having fun and hanging out with all of you guys. So anybody coming Saturday night, I'd love to hear if you're going to make it. It's going to be great information. I really want to see you all there. And then next weekend, I'll be in Cincinnati at the Gather event. So if anybody's going to be in Cincinnati and at Gather, make sure you come and give me a hug, because I love to see all of you in person when I get a chance to do that. So yes, excellent. And make sure you're commenting here. Make sure you're liking or loving this post to win the amazing Rumina Tank Nursing Bra set and the Lactolite set, okay? So we're going to say goodnight, and thank you, Lactolite, and thank you, Rumina, and of course, thank you, Dr. Anna, for being with us.
Thank you
really,
very much.
really appreciate it. Such a good night. And thank you, Mr. Joe.
You're welcome.
All right, here comes Joe.
See you on Saturday.
See you Saturday. Good night, everybody. Love you. Mwah. Bye. Bye. Good night.